Hi, good afternoon. This is Christine Kanata with HCA, and I'm the Family Planning Program Manager. And you are joining us for the Family Planning Only application update. I will give it maybe another minute or two before we get started to get everyone logged in, and then we will get started. Thank you. Okay, good afternoon. It looks like we have almost half of the attendees or registries online. We're going to go ahead and get started because we only have an hour. My name is Christine Kanata again, as I mentioned before. I'm from HCA. I'm the Family Planning Program Manager. And joining me, my co-presenter is Melissa Rivera, the Medicaid Eligibility Policy Manager, and we'll be presenting the Family Planning Only application update. Oh, sorry, excuse me. Just a few housekeeping items. If you do have questions throughout the presentation, you can send your questions through the chat box, and then we'll address them at the end of the presentation. And we also plan to unmute everyone towards the end of the presentation if you'd like to ask your questions during the session. And if you do have any additional questions, yes, please feel free to email us at familyplanning@hca.wa.gov, and that's in the chat. That information is in the chat box. So I'll get started. All right. So the objectives for today's presentation is to review the Family Planning Only eligibility guidelines and application process, to review the step-by-step process for an applicant to complete a Family Planning Only application, to review the changes to the application and the new application cover sheet, frequently asked questions, and lastly, to address any questions. Just as an overview and a reminder, our Family Planning Only program, there are two programs, the Family Planning Only Pregnancy Related Program and the Family Planning Only Program. Qualified individuals under the Family Planning Only Pregnancy Related Program are recently pregnant clients whose Apple Health coverage ended after 60 days post-delivery. And the qualified individuals under the Family Planning Only Program are uninsured individuals seeking to prevent unintended pregnancy. And also the program is open to teens and domestic violence victims who need confidential family planning services. The objectives of the Family Planning Only program are to improve access to family planning and family planning related services, decrease unintended pregnancies, lengthen intervals between pregnancies and births to improve positive birth and health outcomes. The benefits offered to family planning only clients, and as a reminder, this is just a quick overview of the benefits, nothing has changed, are the comprehensive family planning preventive visit, counseling, education, initiation, and management of contraceptive methods, cervical cancer screening, sexually transmitted disease and sexually transmitted infection testing, prescription and non-prescription contraceptives, and sterilization procedures, including vasectomies and tubal ligations. The eligibility guidelines for the program is that the participant must be a Washington resident. The individual must have an income at or below 260% of the federal poverty level, regardless of gender and immigration status. The individual must not be eligible for full scope Apple Health, Medicaid programs, and does not have other health coverage. And as mentioned before, the program is available to insured clients who are seeking confidential family planning services. So to review the application process, applicants should fill out as much information they can provide to ensure that the application will be processed promptly. Applications are processed within 45 days, and the current turnaround time is 10 days. The healthcare authority will contact the applicant if more information is needed, and HCA will either send an approval or denial a physical letter to the applicant. And here's just an updated application timeline for our program. So today and on December 10th and 18th, we are holding the Family Planning Only application update webinars. On December 28th, 2020, we will post the Family Planning Only application webinar recording and Q&A on the HCA website. And on the second week of January 2021, we will communicate new application electronically and post on HCA's website. So now I'm going to pass along the presentation to Melissa Rivera to go over the application step by step. Melissa?
Thanks, Christine. So let's see here. Okay, so we're going to review the sections that were updated, and we're going to first take a look at the initial application as you see here, just so that you can kind of get a look at it, and then in the next slide I will let you know the changes that were made. So just give it a couple of seconds, Christine, and then when you're ready, just flip to the next slide.
Got it.
Okay. So as you can see here, staff who processed the request for family planning only services noticed that some applicants were confused by the question that you see here where it says the old version, are you seeking family planning services? And so sometimes what happened is this box was not checked, and it delayed the processing of the application because the team would have to then contact the applicant to find out whether or not they wanted to apply for family and planning services, and maybe they meant to apply for full scope Apple Health. So the change was that we removed the box, and the text was changed that now says that by filling out this application, they are now acknowledging that they are applying for family planning only services. So we don't have to worry about them not check marking the box. It's now, the person will acknowledge it. So that's the major change on section 1. And then we'll go ahead and go to the second slide. And so this was recently updated. So just allowing you a few seconds to review, and then I will explain what the changes were made at the next slide. And go ahead and change it. So this was probably the major change that we made. And so we had some discussions with some stakeholders, and also CMS agreed that the rule used to be that a person had to apply for full scope Medicaid prior to applying for family planning only services, and if not, they were denied for this program, and then they would be asked to go to the health plan finder and apply for full scope Medicaid. So after much discussion, we always want to encourage folks to apply for Apple Health for full scope Medicaid, but we are allowing them to now opt out of doing so if they choose. So this is where we would ask for your help. So if you are assisting with helping the individual apply for family planning only services, that they review the question and answer cover sheet so that they understand the difference between applying for family planning only services and full scope Apple Health Medicaid. So it'll be under the question, what is full scope Apple Health Medicaid, and should I waive my right to apply for it? We're going to go over that later on, the cover sheet, so you have a better idea. So when you're doing this, you're putting that responsibility on the individual to decide on whether or not they want to just apply for family planning only services or back out and apply for Apple Health through the Washington Health Plan Finder. So, and remember, it only takes about 10 to 15 minutes to go through the Health Plan Finder with real-time eligibility. So we would hate for those that would want to apply for Apple Health to miss out on that opportunity. So this section here is really important, that people who want family planning only services understand it, that this is what they want, and they want to go ahead and opt out of applying for full scope Medicaid. And so hopefully with this, it'll help decrease the number of denials that we have, and are just going to allow people to go ahead and choose to apply for family planning only services, if they want. So let's go ahead and go to the next slide. For sections 2 and 3, we made some minor changes. So I'll just take a few seconds to review, and then we'll show you what the changes were made on the next slide. Okay. So for this was a suggestion or a recommendation from CMS. So it's nothing major. It's something easy that we were able to update, but mainly it was for applicants who are self-employed. It was asked that a note be added that they include their net monthly income. So just where you see the highlighted little boxes is the only minor change that we made, and we're hoping with that it'll just be easier for folks who are filling out this section to do so. And go ahead and go to the next slide, please. So sections 4 to 6 were not changed, but we wanted to use this time to review it and remind that these boxes should be check marked that apply to the individual or their household, and to write in the amount before taxes received on a monthly basis. So if someone other than the individual, for example, their spouse, receives the money or deduction, their name needs to be added on the line where it says who receives this. And then if the income is from the individual, then they would just write in as their self. And then we need to make sure that the individual's tax filing status on number 6 is filled out so that staff can determine who to include in their household. If the individual who's applying for these services happens to be a teen or a victim of domestic violence, and they're applying for confidential services, we only need to include the income of the individual that receives any income if they do. So we don't need income included for other household members or individuals who may claim the team or victim as a tax dependent. And then go ahead and go to the next slide. So if the individual had a recent job loss, we need to make sure that section 7 is completed. This is important because sometimes when the staff is, when we get updates from our data cross matches, they usually are not up to date, and the information on the latest employment may show up. And so if the individual lists in this section that they're no longer employed, then staff can go ahead and contact that employment and just verify that the information in fact had ended. And then go ahead and go to the next slide, please. So if you are assisting the individual to complete this application, we're encouraging you to please have them read number 9, and if the individual would like an authorized representative to fill out section 10. Additional information about the role of the authorized representative, AREP, is included on the FAQ cover sheet that we're going to go over next in the next couple of slides. So this is especially important for those who do not want to be contacted at home or may not want us to send mail to their own address. There have been times that a worker needs to reach out to the individual who has asked for confidential services, but the section, the AREP section, was not completed and staff had no way of contacting that individual, and the case was terminated. So we want to avoid that as much as possible. And I think that's it, Christine.
Thanks, Melissa. Okay, I think we're moving through this pretty fast, so we'll have a good amount of time for questions. Now we're going to review the application cover sheet, the frequently asked questions, and this is the first page of the application, the FAQ. And I'm not going to go over each question and answer. I'm just going to highlight a couple from the FAQ. And the first one we like to highlight is the AREP. So the question is, can you use an authorized representative, an AREP, to apply? And the answer is, an AREP is any adult who is sufficiently aware of the household circumstances and is authorized by the household to act on behalf of the household for eligibility purposes. This is different from partnering with a navigator or broker. So we just wanted to clarify what an AREP was, as Melissa spoke about it in the previous slide, and I just wanted to point that out. And I'll leave this on for a few seconds for you to review if you have any additional questions. All right, moving to the next part of continuation of page 1 for the FAQ. You may review these questions and answers, and I will focus on the question on confidential services. So, what if you need confidential services? Insured individuals may be eligible for confidential family planning services if you meet one of these exceptions: seeking confidential family planning services and are 18 years old or younger, or you are a victim of domestic violence and covered under your abuser's health insurance. Okay, and we will move on to page 2 of the FAQ. And here we have the question on what is full scope Apple Health and should you waive your right to apply for it. So with the updated application, we are giving the applicant the option to waive their right to apply for full scope Apple Health Medicaid, and we wanted to make sure that they were making an informed choice, so we included this question and answer. So what is full scope Apple Health Medicaid, and should you waive your right to apply for it? If you are eligible for full scope Apple Health, you are eligible for all mandatory benefits such as inpatient and outpatient hospital, home health, and physician services, among others, and optional benefits such as prescription drugs, dental services, and physical therapy. It is in your best interest to apply for full scope Apple Health Medicaid in order to receive the maximum health benefits coverage you may be eligible for. For more information on full scope Apple Health, visit, and there's the website, www.hca.wa.gov. It's under Healthcare Services Supports and Apple Health Medicaid Coverage. And I'll leave this up for a few seconds before we move on to the continuation of FAQs on the page 2 FAQs. Okay, and the last part of the FAQs is this page. And I'm focusing on the question, what other health coverage options are available in Washington State? I'm sorry, what other family planning services are available in Washington State? So Washington State's Department of Health's Family Planning Network, which is now the Sexual and Reproductive Health Network, offers a full range of family planning services, and the applicant can receive more information. Oh, I'm sorry, excuse me, what happened here? And the applicant, I forwarded the slide, sorry about that. And the applicant can receive more information by visiting the DOH website, and we have the web address here in the FAQ. And I'll leave this up for a few seconds. Okay, so now before we start answering some questions in the chat box and opening up the floor for questions, we do have one more slide, which my boss, Beth Tinker, she's a clinical nurse manager that I report to. She will be presenting this following slide.
Thanks, Christine. Good afternoon, everybody. My name is Beth Tinker, and like Christine said, I work at the Healthcare Authority with her and Melissa and others. And it seems like we're good on timing, so hopefully we'll have plenty of time for everyone's questions. We have recently been looking into this issue and just thought it was a great opportunity since so many of you are on the line, so I hope you don't mind. Wanted to raise this. You may have immediate reactions. You may have reactions later. You can email us at thefamilyplanning@hca.wa.gov if you have thoughts, because it's something we would like to kind of both unpack as far as what's going on and then hopefully come up with some solutions. So the issue, the problem, we think it's a problem, we're trying to better understand it, is the low utilization of the pregnancy-related family planning program in particular. Now, between the two programs, and Christine highlighted this back on the first slide, the family planning only pregnancy related actually has about 70% of the enrollees between the two programs. So it has a majority of the enrollees. Again, this is a rollover program following pregnancy Medicaid. And so there's kind of two groups that we look at in our data. There's the enrollees, and then there's the participants. So an enrollee is someone who's active on eligibility. That's probably pretty straightforward. And then a participant is someone who is enrolled, first of all, but they've actually had a reimbursable covered service during the period of time. So for the family planning only pregnancy related, again, that would be for that 10-month period of eligibility. And what we have seen in our data is that the utilization for that group is only about 10%. So that means only about 10% of the folks who have rolled over, right? Because they're on the family planning. Sorry, I keep repeating myself, but just to be clear, only about 10% of the enrollees in the pregnancy-related family planning only have utilized our participants in that they've utilized any services. And we think that that is really low, like surprisingly low. And we're curious about it. And we wonder in part if it's, like many problems, there's probably multiple contributors, but we wonder if part of it is that clients aren't aware that they have this coverage, or potentially what the benefits are, or potentially where they can receive the services in those 10 months. So just curious from you all that are, interfacing at the client level, like what you think, if there are folks, either you or folks in your agency, or helping clients to navigate through that, if there's things that we could do better. I've said in some of our internal meetings, a rollover program is great, right? Anything that limits or, decreases the actions that have to take part by the client. And perhaps a downfall, I'm not arguing against it by any means, but perhaps a downfall is people don't realize they have it. That's something that we've been thinking about. But again, what we've seen, and this is not COVID related. Sorry, let me be clear. During COVID, it's down to like 5% utilization, but the kind of 10% has been pretty consistent over time. And that was pre-pandemic. So curious, again, I want to leave the rest of this time today for any questions about the application from Melissa and Christine, but just planting a seed there for folks to think about. And if you can help us, that would be great. And now I think I'll hand it back over to Christine, or I think we're ready just to open it up for, we're going to unmute everyone and let us know, let's have a discussion of questions. And thanks so much.
Thanks, Beth. I think this option to unmute everyone isn't really letting me unmute at once, so I'm going to have to unmute manually. But we can address some questions on the chat box while me and my team start unmuting manually, if that's okay. And I'll address the one that we just spoke about. We had a question from Anna. She's asking, are clients auto-enrolled into the family planning only after their Apple Health pregnancy ends? And the answer to that is yes, just confirming with my team. Melissa, Beth, that's correct, right? They are auto-enrolled.
Oh, sorry.
Yes, that is
yes,
correct.
That is correct. It's correct.
Okay. Sorry, I'm multitasking here. I'm unmuting. Oh, and I hear feedback, so I don't know if we should continue to unmute. Okay, let me go ahead and start reading the questions from the chat box. Okay, I'm trying to do in the order it was received. Okay, so the first question we received is, what is considered a teen, 13 to 19 or just until 18? Anyone of my team members can answer that? Melissa?
Thanks for, yeah. So yeah, that's correct. Up until the age of 18. So once they turn 18, they're no longer considered a teenager. They're a young adult.
Thank you. Okay, the next question is it possible for people to apply on their own without applying through an Apple Health provider? Yes, that is possible. And there are different ways that the applicant can apply, and that's either by phone, fax, email, regular mail, and also through a provider. So those, and all of those modes are listed on the application. Is the application available in other languages? Yes, we are. Yes, they are translated in, help me out here, is it like 15 other languages, team? Something like that, 12 to 15?
Yeah, it's 12 to 15. I can't remember the exact number.
So yes, the answer to that question is yes. The next question is, can a woman apply for family planning if they are not pregnant and have no Social Security number or any immigration status? Or can they only get the family planning benefit, family planning as a benefit after a pregnancy? So to answer that question, yes, a woman can apply for family planning only if they are not pregnant and if they don't have, even if they don't have a Social Security number or immigration status, and that is under our family planning only state program. So they would apply the same way, and our team would then review and process the application, and should she be eligible, she would be under the state funded program. Okay, moving along to the next question. Our clients, okay, I think we addressed that one. Sorry about that. It says clients are not aware of the program. I am told from them their Apple Health ends. Told from them. I'm not sure.
Christina, I think that's probably in response. Sorry, this is Beth talking to my slide.
Oh yes. Okay, so
Yeah.
thank you for your response. Sorry, I'm focused on answering questions, so I'm like, okay. So the next question is, and thank you for your feedback on Beth's slide. Does family planning only pay for multiple different birth controls? For example, IUD insertion and removal if they don't like it, and then another form of birth control. It pays for the RX plus all the office visits. I may need some help on that question, Beth or Melissa Condor.
For some reason, I can't see the question, so can you read it again?
I can't either. That's what I was just going to say.
It's struggle. Yeah. It's a struggle.
I'm the only one. Okay, sorry. Let me read it again. Maybe I can put it in the chat box too, but I'll read it out. Does family planning only pay for multiple different birth controls? For example, IUD insertion and removal if they don't like it, and then another form of birth control. Does it pay for the prescription plus all the office visits?
Yes, and it pays for the office visits as long as it's related to family planning. If they went in, if they're on family planning only and they went into a clinic with a primary goal of just getting something like an STI screen and that was the primary diagnosis, then family planning only would not cover something like that. But if it's a primary family planning diagnosis and it's directly related to that, yes, we'll cover it.
Thanks, Melissa.
Mm-hmm.
Okay, and this is a comment in response to the last slide that Beth presented. One reason of low utilization is probably the increase in IUD use post-pregnancy. They have it placed at their 6-week visit and then have no need to return in that first year. Thanks, Jennifer, for your feedback. Okay, the next question is there any way that family planning benefits could be extended for a longer period of time for a year unless a change like an increase of income? Well, to answer your question here is all you would have to do if your benefits do expire after the year, you would just reapply. Melissa Rivera, I just want to make sure that's accurate.
Can you reread the question, please?
Sure. I'm kind of paraphrasing it. Is there any way that family planning benefits could be extended for a longer period of time, I guess, than a year, unless there is a change like an increase of income?
So yeah, it's usually up to a year, right? And then as it gets closer to that certification period to end, they can always reapply, and there's no limitations on, you know, how many times you reapply after the end of every certification. So absolutely, they can always reapply and then get it extended another year. So I hope that answers the question.
Thanks, Melissa. The next question is, what would be one of the reasons for a client not being auto-enrolled? And I'm assuming auto-enrolled from the family planning pregnancy-related program to the family planning only program.
Yeah, I'm not sure. Go ahead. Sorry.
Was that Melissa? Okay, I was going to say, I think I know, and then Melissa can jump in and correct me if you. So who would not roll over onto the family planning pregnancy related? So folks who qualify and applied for broader coverage would not. So if folks who have applied for comprehensive Apple Health Medicaid coverage, like Medicaid expansion, those folks would not roll over. Folks who move out of state would not roll over, right? It's a state program. Folks who are over income and report that. I mean, it is a rollover. So I think unless a client reports a change in circumstance that were to include a change in income that would put them above, I'm correct, right? It's 260% of the federal poverty level. So those are basically the characteristics of clients that would not roll over onto the family planning pregnancy related for the following 10 months. And actually, the other piece is current state is a little different because of the public health emergency, and CMS has made the decision since March, and this has been renewed thus far every 90 days for a maintenance of eligibility for Medicaid clients. Again, this is a federal rule, so clients currently are being maintained on their current coverage. Not to complicate things, but that is different than kind of what is typical. And so right now, clients who deliver are postpartum, and it's past the end of the month in which the 60th day postpartum falls, and typically they would roll over. They are actually continuing on their full scope Medicaid coverage. That CMS allowance is next up to be renewed in the middle of January. It sounds like folks assume that that will be renewed for another 90 days at that time, but that's, you know, that is something that can change every 90 days without renewal.
Thanks, Beth.
Yeah.
Okay, the next question is, have you thought about changing the name of the program? When I tell teens about family planning only, they give me a blank look. I don't think that the term family planning is one that all folks understand. Thanks. Thank you, Celia, for your recommendation. This is something that we've been asked, and it's just been in discussion with our team. We recently changed the program from Take Charge to Family Planning Only. So this is something that we're still in talks about. Beth, did you want to chime in on this recommendation?
Sure. It's a great question. We are certainly aware of the ongoing conversations about language and uphold and respect the importance of language. But yeah, there are clients that are needing contraceptive care who are not planning a family, who are not interested in planning a family or having a family, or all sorts of different scenarios. And it's super complex, and we think that there's unintended consequences with changing names a lot of programs. We're still kind of dealing with some confusion about changing from Take Charge to Family Planning Only. And so we're hesitant. I mean, we're talking about it. I think what Christine said is really fair. We're aware, and we certainly agree with the rationale. You know, the important part, and Melissa Condor mentioned this earlier about the family planning only programs, is that the primary diagnosis does have to be contraceptive related. And so when to think about, like, well, if there was a more appropriate name that was more broadly, you know, kind of appropriate, I suppose, what would it be? And it would probably have to have something about contraception in it. And then we worry about kind of understandability of that term, or birth control. Anyway, I guess I'm rambling. I just want everyone to know that we are talking about it, and we at this time do not have any concrete plans for kind of the reasons that I've mentioned. But we appreciate you bringing it up. We expected that somebody would. So, point taken.
Thanks, Beth. So the next question is, this is in relation to the last slide we presented. Does the 10% utilization include those on LARC, a long-acting plan right after birth of child?
This is Beth. It does. And someone else made that comment earlier about, you know, if we're having increased access and utilization to LARCs, we would anticipate decreased utilization, which I totally agree. And this is why data is you always got to try to understand the story behind the data. But we also think even with LARCs that 10% just seems low. But it could be wrong. Maybe that's appropriate. But that was kind of our thinking, that even with increased utilization of LARCs and even post-placental LARCs, that we still feel like that number is probably lower and not representing what actually the need is.
Thanks, Beth. We have another question regarding utilization. How are DOH family planning benefits different from the HCA family planning program? Could these differences explain utilization? I think that's a pretty loaded question.
I'm so sorry. Can you repeat the question?
Sorry. How are DOH family planning benefits different from the HCA family planning program? Could these differences explain utilization?
Yeah, I mean, my first question with that, I appreciate that. That's thoughtful. I don't know what the utilization looks like for the DOH former Title 10, but that's a good question. Actually, Christine, we asked them, didn't we? I'm getting confused. That's planting a little. That's a good question.
Yeah, I have Cynthia on the line. We can chat with her on that and then get that out as part of the.
Okay.
I think she's listening in only when we send out the question and answer. But thank you. And then someone says, "Hi, Beth Tinker. What a nice surprise to hear your voice, Celia Thomas." That's nice.
That's super nice. Thank you, Celia. I feel special.
Okay, and the next question is auto enrollment also applicable to those who are losing coverage due to immigration status? And I'll read the question again. Is auto enrollment also applicable to those who are losing coverage due to immigration status?
I'm thinking through the context, losing coverage because of immigration status. I don't think that is, I wonder if you're talking about folks post-pregnant. So pregnancy Medicaid is for all pregnant clients, right, who are residents of Washington, regardless of citizenship. So no one is losing that coverage because of citizenship. I'm sorry, I'm not totally clear on who we're talking about. Melissa, are you? Oh, Melissa Rivera says she lost sound.
Yeah. Melissa, can you hear us? I can hear Beth, and it looks like my audio is okay.
Can you hear me?
Okay.
Yeah.
Yes.
Yeah.
Okay.
Melissa, did you have a better understanding or context for that question about clients who are losing coverage because of their citizenship or documentation status?
I did not hear the question, so can you repeat it, please?
Yeah, sure. I'll read it again. Is auto enrollment also applicable to those who are losing coverage due to immigration status?
So when they lose coverage, are we talking about just family planning only services, or are we talking about after they were had their baby? I think in both cases, if they had their baby, they would be auto enrolled in family planning only services for the 10 months. So it doesn't have anything to do with their citizenship and immigration status. And then if they just strictly, if they are they weren't pregnant and they're applying for family planning only services, immigration status would not be a factor either. And so it's just based on their income and then, you know, the other criterias, but citizenship and immigration is not a factor, and they can apply, and if they're eligible, they can get it up to a year, and then again, they can reapply as many times as they want to. So I hope that answers it.
Thanks, Melissa. Okay, the next question is actually a comment, and I'm going to read it out. The eligibility for pregnancy medical currently is 293% of the federal poverty level and 298% with MAGI. Some became ineligible for family planning only. The family planning only 260% of the federal poverty level. This accounts for some drop off of family planning services, although we don't know the extent yet, but we can check. So that's a comment. Thanks, Joyce. Another comment is we run into some issues when trying to print the Spanish application. Thanks, Anna. We will look into why that is when we do provide the translated version, and I'll bring that up to the communications team. This question is the coverage available for undocumented clients? Yes, it is. I mentioned this a little earlier. If the applicant does not have is undocumented or is non-citizen, the client may qualify for our state-funded family planning only program. And we have another comment. Men are eligible too. That's correct. And then we have a question from Leslie. Can you very quickly address the state-funded program so that people are aware of the difference between the two programs and that another application will be forthcoming? Yes, Leslie. So as I mentioned before, if the applicant does not qualify for our federally funded program, which means that the applicant is undocumented or non-citizen, their application will be processed, and our processing team will then, based off of the information, will either approve or deny their application, and that particular group is eligible for our state-funded family planning only program. And also, this is a whole nother webinar, but we do plan on releasing a non-citizen application, and we're aiming for January 2021 to present it as a webinar and release it hopefully in the same month or by February. And so there will be a non-citizen application, and then there will be the standard family planning only application. And that application is the one that we're going over today. So I hope that was helpful. Anyone else on the team like to chime in? I think I've answered.
This is Melissa. I just want people to also know that today they don't need that separate application to apply for family planning only services. So if they do not meet the citizenship requirements, they'll still qualify. It's just everyone's using the same application today, and then come next year, we'll have two separate applications. So we don't want anyone to be discouraged, and want everyone to know that it doesn't matter on your citizenship. You can apply today and apply for it, and we would look at eligibility.
Thanks, Melissa. Thanks for including that. Yeah, we still have quite a bit of questions, and we still have about 11 minutes, so I'm just going to keep going along. Thanks everyone for your participation. This is great engagement. The next question is it a paper application, or will it be included on the regular Washington Apple Health application on Health Plan Finder? So it is a paper application, but you can also find it online. And I'm going to throw the second half of the question to Melissa Rivera. So I know that it's currently not. Is it currently included on the Washington Apple Health application on Health Plan Finder? Melissa, can you verify that?
It is not. So people can apply through the paper application. They can call, they can fax, or face-to-face. It is not in Health Plan Finder. And I think, when with the Affordable Care Act, when the Health Plan Finder system was created, to apply for full scope Medicaid, it meant that you applied for all the requirements that met the minimum essential coverage to go through the Health Plan Finder. And family planning services only, of course, did not meet that minimum essential coverage. So that's why it was never included in the very beginning. But there is talks on how we can do it. We have not, we don't have an answer if it's going to happen or not. And if it does, I mean, it's going to be probably a year out. But you know, we are talking about it. It's something that if we could do it, we could. It's just, you know, we have to get other agencies involved and then, you know, talk about how the system can be updated and et cetera.
Thanks, Melissa. Next question is there a different application for the family planning only state program? Are males able to apply for the family planning only program? So currently there is not a different application for the family planning only. It's the non-citizen program. However, as I mentioned before, and I think this question was asked before I mentioned it, so we're hoping to release that in January or February, depending on just the processes that we have to go through. And yes, males are able to apply for the family planning only program. The next question is, if the client chooses to apply for regular Apple Health, do they need to fill out the entire family planning application again? So I'm going to read that question again to the team. If the client chooses to apply for regular Apple Health, do they need to fill out the entire family planning application again?
So I guess it depends on how, you know, how long ago they did it. So if they apply for Apple Health, let's say last week, and they were denied Apple Health, then they would not have to complete the whole application for family planning services. They would just, there's a section that they just need to fill out, just enough to, you know, gather information as far as who they are. And staff can use the recent information that they used in Health Plan Finder to finish the application. Now, if we're talking about the person applied a year ago or 6 months ago, we probably would want them to fill out the family planning only application because, you know, things may have changed. And then if they did apply for Apple Health and were approved, then they would not have to apply for family planning only. And that's probably obvious, but I just wanted to throw that out there.
Thanks, Melissa. We have another question about auto enrollment. So even individuals who do not have a social security number would also be auto enrolled, correct? I think she's referring, go ahead.
Yeah.
Sorry.
Yeah. So this is Melissa. So auto enrollment would be if you had a baby, right, and you finished your 60 days of the postpartum, you would be auto enrolled. So that's when auto enrollment happens. But if you're on the family planning only services where pregnancy is not related, so you weren't pregnant, it's not auto enrolled. You would get a letter that lets you know that your services is ending and you would have to reapply. And at this time, it's not an auto enrollment. You'd have to manually do it.
Thanks, Melissa. Okay, so moving along. Sorry, I lost my place. Oh, are participants notified that coverage is continued due to COVID? That's a really good question, Jan. Beth, I think you may have an answer for this.
I wish I had an answer for that.
This is Melissa. Yeah, they will get a letter that says that they are being extended out for another 3 months.
Do they get that with every renewal, Melissa? Like every 90 days cycle
Yes.
that a new letter goes out? Perfect.
Yes.
Okay.
All right, thanks, Melissa. Oh, we have a name suggestion, reproductive health. Thank you, Joyce.
I like that.
And LARCs are not the most popular birth control method. It is birth control pills. So that's also from Joyce Fan. Thanks, Joyce. Cynthia Harris from DOH says that the sexual health and reproductive program, DOH's program, would only cover clients that were not eligible for family planning only. Thank you for that. We have a question. I wonder if it's because, a question. Wonder if it's because family planning only take charge used to require documentation status.
Right. Citizenship and immigration documents were required, used to be, right? So today, I mean, we just need to know whether or not you're a citizen, and we do still need documentation, and it's only to determine if when you are eligible on which program, which pot of money the services are going to get paid for, whether it's federal or state. So we would just need to know, where to put you at. So I guess we still would need to, but it would not make you ineligible if you were not a citizen.
Thanks, Melissa. So we have a question about undocumented male. So an undocumented male can apply for family planning and choose to get the vasectomy and get it paid. Just confirming this is also a benefit for men. Yes, that's correct. Okay, follow-up question. I'm not sure if I understood correctly. Can a person who is not documented apply for family planning only, even if it's not after pregnancy? Yes. So an undocumented applicant can apply for family planning only, and that he or she will be covered, or the applicant will be covered under our state-funded program. Hope that clarified it, Juan. Next question. If the client is not auto-enrolled after their Medicaid expires, do us navigators just help the client with a family planning only application?
Yes, absolutely. If the client comes to you and asks for help, it's a matter of just refilling out the application, and then staff would redetermine eligibility.
Okay, and then Erica Delgado, she said extension of benefits as of when. Erica, can you clarify the question you're asking there? And this is actually the last question. I can unmute you, Erica, if you want, or if you wanted to add something in the chat box. Family planning only. Okay, so the question was extensions of family planning only, extension of benefits as of when. Question's not quite clear to me. Let me move up to see if you.
Christine, I wonder if she's talking about what I mentioned about the CMS rule for maintenance of eligibility.
Okay.
Although I'm not
makes
totally
sense.
sure, but that's what came to mind.
Erica, is that correct? You can go ahead. She said yes.
Okay, so I think the question was since when? I'm sorry, this is that I can't read the.
As of when?
Okay, so my understanding was that the first MOE, the first maintenance of eligibility was March. It was really early on in the pandemic. I feel like it was March 20th, maybe. And then up till now, it has been renewed every 90 days. The current
it was March 18th, Beth. This is Melissa.
Oh, perfect.
March 18th. Yeah.
The current MOE, maintenance of eligibility, expires January. It's kind of right around like the 20th, I believe, or somewhere there. What I have heard is folks pretty overall anticipate that it will be renewed for another 90 days. And kind of looking at where we're at, it doesn't seem unreasonable to think it will be extended even beyond that. But it's not a guarantee. There has to be a decision made every 90 days to continue to extend the maintenance of eligibility. And again, that's at the federal level. Does that help? So it started March 18th.
She said thank you.
Yeah.
Thanks, Beth. Thanks, Melissa. We're actually out of time, but I can to cover this last question. Can you verify the federal poverty levels? Is it 138% for Apple Health Medicaid, 193% for pregnancy Medicaid, and 260% for family planning only? So yes, it's 260% for family planning only. Melissa, do you have the percentages for Apple Health Medicaid and pregnancy Medicaid?
The Apple Health
Off the top-
Medicaid is, yeah, it's 133%, and then for the pregnancy, it's 193%.
Perfect. Thank you.
Mhm.
Well, perfect timing. We are at the end of the webinar, actually a minute over now. Thank you for attending the webinar, and thank you, team, for helping with all the questions. We fielded all the questions in the chat box, but we will actually also send this out. It'll be a frequently asked question document on the website that we will send out at the end of December. And if you have any additional questions, please email us at familyplanning@hca.wa.gov. Thank you everyone for your participation, and have a great day.